Hi, I'm Sharrie Harlin, program host for Reid Beside You. And today our guest is Morgan Gunder, Community Outreach and Broker Liaison for Health Alliance. And what you can do is help us understand what Reid Health Alliance is.
Absolutely. Well, first, thanks for having me today. I'm excited to be here.
Well, welcome.
Reid and Health Alliance have partnered to bring a Medicare Advantage plan to the community. And so what they're trying to do is bring a new option for individuals here. Health Alliance has been around for more than 30 years. They are based in Illinois. They have plans also in Washington and Iowa as well.
The state of Washington, correct?
Yes, state of Washington. They're excited. We are excited to be a part of the community and have a local office right here in Richmond.
And speaking of local, even though Health Alliance is based in Illinois, that you actually live in the Wayne County community.
Yes, I do. I live around here. I grew up in this area. My husband is from Richmond as well. We have a 6-year-old daughter, so I have been around for a while, and I'm excited to be a part of the community in a different aspect.
Well, great.
Yeah.
And a big question is Reid Health. When you will hear us say Reid Health Alliance Medicare.
Yes.
Is that owned by Reid Health?
It is not. It is a partnership. So Reid and Health Alliance wanted to partner to bring an option, a Medicare Advantage option, to this community. Yeah.
And so are the doctors and the hospitals, where can I use one of your plans?
Sure. So we have a large network of providers, but it is mainly a Reid provider network. When an individual comes in and wants to ask questions about this, we sit down and we talk about current doctors that they do have and how we can help them. And if they're doctors in the network, keeping them. And if not, we walk them through the process of finding a new primary care physician.
And if they, for pharmacies, because with Medicare, one of the biggest concerns are with getting their prescriptions filled. So what pharmacies are included in your plan?
Sure, that's a great question. So we have preferred pharmacies, and so within this area we're excited that we have some local options. First, on a more nation basis, we have Walgreens, which is a network preferred pharmacy.
Okay.
And then after that, we also have MediCenter, which is located in Liberty, Connorsville, and Cambridge City. And then we also have Reid Hospital's pharmacy, which is in the basement of the main campus.
And if I wasn't part of one of the national networks, if I wanted to go somewhere locally?
Yeah, so we also have just in-network pharmacies, and that's an option like Phillips Drugs or Walmart, CVS. But when an individual chooses to use a pharmacy that may not be a preferred pharmacy, those individuals may have to pay a little bit for their prescription drugs, as where if you use a preferred pharmacy, as the 3 I mentioned, you will get $0 tier 1 generic drugs. So that's the advantage of using a preferred pharmacy.
So most of the time we have people that are very often confused because it is overwhelming. What do I choose? How do I get started? So where will we start?
Absolutely. So first and foremost, I've said we have a local office here in Richmond. It's at 600 East Main Street.
So as a lot of local people will recognize, the 600 building is across the street from Elder Bierman, as well as next door to Joy Inn Bakery.
Yes, and it is in with Reid's Patient Financial Services. And so that's a good option first to be able to come in and see someone. But also in this area, right now during annual enrollment period, which is October 15th through December 7th, individuals have the option to go to seminars. So within each county, and we'll cover what counties the plan is in, individuals can go to seminars and get information and talk with brokers who sell our plan. And then you can always call our 800 number. We very much pride ourselves on the fact that we try to answer calls within 30 seconds and you will not talk to a machine. So being able to call and ask those questions. And then for the tech-savvy users who like to be on computers, they can always get online, healthalliancemedicare.org, and they can get on there and they can see and sign up for the plan and check out all the information. So we have multiple options to help individuals sign up.
So it sounds like it's very simple and informative.
Sure.
And a way that you have people in your office
Yes.
as well as out in the community.
Yes, we do like to keep it simple and informative. We like to give people the guidance to feel like the decision that they're making is they're confident in that decision.
So let's go back and see, what is Medicare Advantage?
So that is probably the question of the hour. So a Medicare Advantage plan, which is also known as Part C, these graphs right here actually will tell you quite a bit of information.
Okay.
It takes your Medicare Part A, your Medicare Part B, otherwise known as medical coverage or doctors, and then your Part D, which is optional with many plans, and it combines that into one complete coverage. So we tell individuals to take your red, white, and blue card and put that in a safe place. And now you will carry a card by itself, and that will serve as your insurance card at all places. And if you have pharmacy on your plan, then that will also be the card you'll use at the pharmacy as well. So that's in a simple form, that's what a Medicare Advantage plan is.
So if I currently have a Medicare supplement, can you explain the difference between
Yeah.
a supplement and the advantages of an Advantage plan?
Sure. So the biggest difference between the two is Medicare supplements often will go up each year. The premium can increase from year to year. Medicare Advantage plans usually stay within a lower, they're not as expensive.
Okay.
They're usually more affordable. So that is one of the large differences between them. With a Medicare Advantage plan, the advantage is having a maximum out of pocket in 1 year. So you know in your worst case scenario how much that you will ever have to pay within 1 year. So that's really the advantage.
So there's basically a maximum spending amount.
Yes, absolutely.
Okay. And where will your plans be offered
That's great.
this year?
Yeah, so people may have heard about Reid Health Alliance in the last year because we were in some counties last year, but the biggest excitement this year is that we have now entered into some new counties. And so for 2018, we will be in Wayne, Randolph, Henry, Fayette, Franklin, and Union within Indiana, and then Darke and Preble counties in Ohio.
And for a person that does a lot of insurance, this is very exciting.
Yes.
Because a lot of insurance plans, we can't cross state lines.
Yeah.
However, under this plan with Medicare Advantage,
Yep.
we do cross state lines, and so this is huge for the Reid service area.
Yes.
And so timing is important, and I know we discussed it before, but I can't stress enough the times that they can sign up. So can you tell me about the annual election period?
Yes. So again, it is October 15th through December 7th. This is the time that we tell individuals to really assess your coverage. What may be good for you 1 year very well may not be good for you for the next. And even 5 years ago, individuals may have been on a plan and they think it's working great, but things change year to year, from your benefits to your premiums to your co-pays, co-insurances, things change. So we really recommend during this time period to look at and assess your coverage and see what works for you.
And when we're talking coverage, we mean, for instance, if you've had a new diagnosis.
Correct.
So you might need to reassess the prescriptions that you would use, how many doctor visits.
Absolutely.
You might need a specialist. So is
Individuals
that is what we mean by looking at your coverage.
Yes. Yep.
Great. And as we're moving into the year, why would someone, as they're looking at their coverage, why would we switch from your current plan to the Reid Health Alliance plan?
Well, depending upon the insurance that you currently have, you very well may get more coverage with a Medicare Advantage plan. So that's something that we really like to assess. Every situation is different, and so that's why we say, come sit down with us, let us talk through it, compare your plans, and see if this is a better option for you.
And would you have to change doctors?
Not
If you join the Reid Health Alliance Medicare plan?
So not necessarily. We take that and we look. So if you have a primary care physician that is already within our network, we have a large network of providers. We go through and we check those doctors. And then if, for instance, their doctor is not within our network, we then sit down and we ask them what's most important. And so if it's not, we will look to help find a new doctor for them and walk the process through with them.
And I've been fortunate enough to be in some of those meetings, and we had situations where we found there was a couple doctors that people really wanted, they were interested in, that they weren't, well, we didn't think they were a part of the plan, but they actually were. It might be that a lot of times when we ask people about your primary care physician, if you've recently had a heart attack, often the only person they're thinking about is their cardiologist.
Okay, yeah.
So,
So really getting
often
them.
they are naming one doctor, but the doctor's actually in the plan, and they just
Yeah.
weren't aware of it. So
Yeah.
we want to make that clear as well.
Yeah.
And so what do your members like the most about Medicare Advantage?
So some of the things that we always like to mention, when Medicare Advantage is usually a little more affordable than a Medicare supplement plan, you also get some extra perks with that, like fitness benefits, dental, perks, travel assistance also comes with that. $0 Tier 1 drugs at those preferred pharmacies that I mentioned, MediCenter, Walgreens, and Reid Hospital's pharmacy. Those are some of the biggest things. And then again, having a local office here as a Medicare Advantage plan, that's huge when you think I can put a face to a company. Having people be able to walk in, sit down, have a conversation about, say, something they've received in the mail. And so we like to be able to have that advantage for people to be able to come see us.
And one of the newer perks of the Medicare Advantage plan, could you tell us about the hearing aids?
Yes, so that is also a perk that is in there that we like to talk about hearing benefits. Yeah.
And that, I know that was it was a big hit.
Yeah.
When they announced that they would be offering that.
Yeah.
And when you're often out in the community, when you're in the communities, give us some examples of some community events that Health Alliance participates in.
Sure. So my role as the community liaison is education, and it is getting to know members, getting to know providers, being out there. So you'll often find me at health events, health fairs. I also do educational presentations. And so the educational presentations we really like to tell people about. I have them at libraries, senior centers, things like that. And what we do is we have an array of topics that we like to discuss. And so one of the things that people like to hear is in the spring we do a presentation called Downsizing and Decluttering. And some people think, you're in healthcare and why are you talking about that? But one of the things is as people age, you have things, you have collected them over the years.
Right.
And so when you think about all of that stuff, how as you age can you reduce that? Because not only does it help reduce stress, but clutter is linked to depression. Clutter is also linked to fall risk. And so we teach people how can you get help with it? What are your resources and how can you do that? So that's just one example of presentations that we do. And we talk about fraud prevention, we talk about the ABCs of Medicare, understanding the differences between Medicare supplements and Medicare Advantages. So those are some of the presentations. And then we work closely with area agencies such as LifeStream. We like building relationships with different community partners to say, we're here to stay, we want to get to know everyone here, and again, keep that face to the company. And
another example, I know that you were most recently in the Fall Festival.
Yes.
And how did that go?
Oh, it was great. It was a lot of fun. Gotten to know a lot of people. They stopped by.
So and I need to clarify on that. Well, the Fall Festival is held in,
it's in Union County.
In Union County?
It's by Dunlapsville.
Dunlapsville, Brookville Lake area.
Yes, LifeStream holds it. It was a wonderful activity. I think the rain held a few people off this year, but there was usually it's a few hundred people stop in and they do all kinds of activities. And we just give out information, again, just to educate people.
And you did an event in Preble County with the Senior Center. You went on a...
Yes, we sponsored.
Went out on a game I missed.
We have sponsored some trips. We sponsored a Cincinnati Reds. They have a group called the Time Travelers there. And so we sponsored a trip to see them. That was a lot of fun. Yes, the sponsorships and things like that, it is fun because we really get to know people on a personal basis and they tell us their stories and stuff. And so we really like that.
And so we like to show that. And as you can see from our discussion, that you were in Union County, you've been in Preble County. I know you work with the Senior Center and Richmond.
Yeah.
So we're really trying to cover all of the entire Reid service area.
Yeah. we do.
Great. So if someone needed extra help and they had limited resources, where's some places they would go?
Yeah, so when we meet with people and we have conversations with them and we're trying to figure out what's right for them, we like to talk about extra help is what they refer to it as. So for an individual who may have limited resources, we will tell them, you know, maybe stopping by your Social Security office because there are ways to help with your Part D. Also, there is what we call SHIP counselors, and that stands for a state health insurance program counselor. And they are an unbiased opinion, but they will help give guidance to options that are out there for them. And they'll walk them through based on their current situations of plans and options that they may have. And then also, Reid's Patient Financial Services is also a great resource. That is a place that individuals can go because maybe they're just not sure. Maybe they need help with a hospital bill, things like that. So we send them based on their situation over there to talk to them. So those are just a few resources that are available.
Great. I want to bring up one of these that we have right here and just go into a little bit more on just original Medicare and what's covered under Part A and B. If we can, let's go over that, please.
Yeah, sure. So under Original Medicare, you have your Parts A and your Part B. And again, your Part A will cover your hospital coverage, as well as skilled nursing facility, hospice, and then some other types of home health care services. And then within your Part B, they consider that your doctor's visits, your outpatient care, and then some other home health services. So that makes up your original Parts A and B. And then when you stick with just Original Medicare, you would choose a standalone Part D, and that's with a private insurance company. Okay. So that's where you can have your original Medicare.
So you have your original, and then if you had the standalone Part B, but that's additional money.
Correct.
Correct?
That
okay.
is. Yes, and then for any individuals who are wanting that extra coverage, the extra help to help cover what Original Medicare does not cover, you have an option of a Medicare supplement plan. And then that's where we like to talk about the differences, because you'll have three different companies to deal with within that. But then here within your Medicare Advantage part, it is all in one package.
One package.
Exactly.
Okay. And
then you have your extra perks like the fitness programs and your dental perks and things like that. So it's an option. To us, it's a really great option to look at. Yeah.
And as a person who goes through the hospital often when people are looking at their bills, and a lot of times people think they're saving money, so they would have maybe Part A, but not Part B.
Okay.
Because they assume they were saving money, and then they find out things aren't covered.
Yeah, and you can be penalized for not having your Part B, and so that's
right.
Yes.
So we want to make sure that another thing is that you should be investigating that as soon as you're eligible.
Yes, absolutely.
Can we talk about being penalized?
Yeah, so just a little bit, your Parts B and your Part D, when it is time you're eligible for Medicare and it's time to go sign up, you have the option to enroll in your Part B. If you do not enroll in Part B, you can be penalized for that, and it will stick with you for a lifetime. So as long as you're on Medicare, it's with you. That's tough to think about. And then your Part D as well. So if you choose, unless you have credible coverage, meaning a pharmacy plan that you have that credible coverage through, you would want to pick up a Part D. And so, like I said, when you think about a Medicare Advantage plan, it's all together. It's not something where you have to worry about which one don't I have. You have to have your Parts B with a Medicare Advantage plan, but having it all together and then not having to worry about having those penalties. Yeah.
Right, and that is so important.
It is.
And I believe they start to send you information 6 months before you turn 65?
Yeah. So you can enroll 3 months prior to turning 65, the month of 65, and 3 months after. That's your enrollment, your initial enrollment period. And then each year, again, like we've talked about, you have the option to make those changes from October 15th through December 7th. So it's time to get out there. I know that individuals get bombarded in the mail with lots of stuff, so it's hard to get through all of that and then decide what do I need to know, what's available here. So that's hopefully people will see a new option for them with this plan.
I know that it seems like about a week ago, around the 1st of October.
Yep.
And if you happen to be like me and couldn't sleep, when it's late night, you start to see all these different Medicare Advantage plans.
Yes.
And one of the reasons that Reid Health chose to work with Health Alliance, because we have very similar values. We're from small town, we're in Midwest based. So when people ask all the time, why did Reid choose Health Alliance when there's so many other larger options?
Right.
And that's the reason.
Yeah.
We felt like it was a better fit.
Yeah.
We work well together.
That's what we like to do, is to partner with where we feel like our values and are the same, and that at the end of the day, it is about the patient and the members and helping them most.
Okay. So the I was trying to figure out, and trying to also tell people, don't wait. Another big thing is, please don't wait until December.
Oh, very close, December 6th, December 7th.
It's December 6th or 7th.
Yeah.
Because that's also a challenge that people will wait, or especially if someone's a caregiver or adult children who are working with their parents.
Yes.
I know last year, and we didn't have a plan in Wayne County at the time, but we received, I personally received a lot of calls.
Yes.
And just with the insurance on how to help, what do we do? So one of the biggest things we like to share with people is, please, as soon as you can, try to make those decisions, get in, and just don't wait till the last minute.
Yes.
Because often if you wait till the last minute, then you are, people tend to make mistakes, and they just choose anything.
Yeah, it's and it can be overwhelming to some people, and so that's why we like to say, go to those seminars that we talk about. Individuals, right now we have, there are TV commercials, there are billboards, there are pieces coming in individuals' mail. And so we like to show all those. I know that there was an article in the paper that talks about the seminar times and things like that. So we really like to tell people what all of the options are for them, so that they can get started early and make that decision. So it is incredibly important.
And we also have you will see the Health Alliance billboards. I've seen some on 70. And then they will start to run, their commercials are starting to run locally.
Yes.
So then just to keep
get the word out.
The information, keeping the word out. And how can someone get more information about Reid Health Alliance Medicare?
Sure. So the seminars are a good place to start. If you're wanting to just kind of go in a group setting and be able to just sit and listen to a broker, have those to cover all the benefits and go over everything, that's your first option that is available right now. Of course, the office, popping in, we are open Monday through Friday. 9 a.m. to 12 p.m. noon, and then 1 p.m. to 4 p.m.
We give you time for lunch.
Yes, yes.
Okay.
And so come in, have a cup of coffee with us. That's the first one. That's the second one, I'm sorry. And then we have online, the healthalliancemedicare.org. You can get on there and check out the plan benefits, things like that. And then we have an 877 number, and that's 877-749-3002. And you can call and you will speak to someone and have a conversation, and they will help walk you through just the same way.
And you have aside from yourself, there are other people in your office, correct?
We do. We have some member service reps that are in our office, and so they can come in, have conversations with them. They can also help them with the plan and making those decisions too.
And also, I don't want to exclude your relationship with the various insurance brokers locally.
Yes, yes, we do. We have relationships with various insurance brokers in this area who sell the plan for us. So they can always check if they're looking to sign up for the plan. Ask your broker if they're currently selling the Health Alliance Medicare plan.
So if I'm with my so in addition to coming to see you, I can go to my regular insurance agent who can explain that as well. So that's great.
Yeah.
And was there anything else that you would like to share with our audience?
We're just very excited to be in this area, very excited to get to know these members and all of the providers and be a part of the community. And I appreciate you having me on here today. And so hopefully we'll get to know these members and get to have a great next year.
Well, great. Well, we look forward to sharing, as well as hoping that we have a lot of people to sign up for Reid Health Medicare and Reid Health Alliance, the Medicare plan. A long one there. But we want to thank Morgan for joining us today. And once again, make sure that you do sign up for Reid Health Medicare Alliance. Reid Health Alliance Medicare plan. We're going to get that straight. And thank you for joining us today.